forward to welcoming you to our hospital's international courses.
We are delighted to launch the first international educational program series at Imam Reza General Hospital, Tabriz, Iran.
Tabriz is a historical and vibrant city.
You will love our beloved city.
Join us for our educational programs.
We'd love to have you here.
Waiting for nice days together.
See you soon!
Hello everybody, I'm pleased today to host Dr. Babak Nejati to talk about his programs, educational programs and projects. Dr. Nejati is the Associate Professor in Hematology and Oncology in Tabriz University of Medical Sciences. Thank you, Dr. Babak Nejati, to accept our invitation and come to this studio today. Thank you.
Thank you so much. Good morning. Everything all right. I am grateful to Dr. Soleiman program, Dr. Soleiman Zaden Research Center, and I hope the participants have a nice time and according to structure go on. I am Babak Nejati. I have hemato-oncology subspecialty in the Tabriz University of Medical Sciences, and then I received the stem cell transplantation in Tehran University and continue in Turkey, and 6 months in Turkey I completed my stem cell transplantation course. And now I am the attendant of the Tabriz University of Medical Sciences and head of the department of the stem cell transplantation unit of Imam Reza Hospital.
Okay. Thank you. I would actually like to ask you about what you are doing exactly now when we talk about transplantation, stem cell transplantation. What are exactly your activities and how can you describe your practice?
Hemato-oncology ward started in 30 years ago, but because of difficulties of stem cell transplantation not began. In 2015, I have started transplantation with a patient with multiple myeloma, and she is still in complete remission. After the autologous transplantation, we tried to do the allogenic transplantation. Allogenic transplantation is very important in our centers. In allogenic transplantation, our first patient have AML and transplanted with his brother and also he is in remission. After this, we tried and make progress to allogenic transplantation from unrelated donor or haploidentical transplantation. After unrelated donor, a patient from Hodgkin lymphoma with the possibility of registry of patients and donors is started for us. That is very important, and we can register the donors and patients in a system. That system linked to the ministry and all countries.
So it is a nationwide registry system?
Yes, yes, nation registry system, and all countries can take that system. After that, haploidentical transplantation for patients with malignant began, and haploidentical transplantation for non-malignant disease such as thalassemia, aplastic anemia, very difficulties because of the malignant cell were not there, and is done very limited centers in the neighboring countries. But we can do it, and in haploidentical transplantation, we are first in the Iran, and we have many patients from neighboring countries such as Iraq, Azerbaijan, Saudi Arabia, and Syria.
Let me ask again, if I understand good, you are the first center in the country doing the recent generation of activities in stem cell transplantation, as far as I understood.
Haploidentical. I noticed that haploidentical transplantation. In allogenic transplantation, we can do the transplantation from related donor or unrelated donor. That is easy for us. They are matched HLA, matched genetic with the patient. But some patients, because of the limited family number, don't have the full match donor. Because of that, everyone, can I say 100%, have haploidentical donor. Haploidentical don't match with the patient. And this procedure have very complications. I say about haploidentical transplantation, we are, especially non-malignant disease, we are first in the country and the neighboring countries.
Great. It means considerable achievements. Congratulations. It is really
Thanks very much.
Great. In the meantime, I would like to go to the courses or course you have designed for participants coming from other countries.
Okay.
Would you please explain what the course contains and what you can provide to the participants?
In other courses is practical and theoretical. All the journal club or grand round, we have sessions. The first session of us is in the clinic. In the clinic, the patients referred for the stem cell transplantation. We just assessment the indication of the transplantation, and then do the consultation and lab test about stem cell transplantation, and such as HLA typing for selection of the best donor. The next session is in our unit, and we mobilization the patient, then conditioning regime give the patient. Conditioning regimes are different: myeloablative, non-myeloablative, and RIC or RIC. All of them we can give the patient dependent on the performance status and underlying disease and other parameters. After conditioning, we stem cell collection and stem cell transplantation training with the participant. For the stem cell transplantation, many factors is in detail, and I just don't time for say all of them. And then we discuss about the complications of the transplantation. The important complication is the graft versus host disease and infection. All participants should learn them. After that, the cell therapy or cell manipulation is the very exciting and expanding field. We can educate, training, and collaborated with other PhD participants or the internist or other participants for the cell manipulation. Cell manipulation just the base of therapy of many of diseases. So stem cell transplantation now expanded for treatment of many diseases, and monthly an indication is added for the stem cell transplantation, such as autoimmune disease, sclerodermy, MS, and so on. After this manipulation of the cells with my colleagues, we discharge the patient, and in the clinic we assess the complication of the transplantation every week. And the participant hand in this process. We can do all types of transplanted in this center, and today one of our patients will be transplanted. And today is 15 January 2024. Let's go to see the patient. Hello, how are you? Thanks. This patient is from Iraq and can only speak Arabic. We accept patients from all neighboring countries. And she had major thalassemia and some complications in liver because of the iron overload in massive transfusion. And today she will be transplanted, and now she is under treatment with reduced intensity conditioning regime with ATG.
Okay, good. As far as I understand, so you'll recommend mostly the course to the internist specialists in medicine, and also you can cooperate and collaborate with PhD degree graduates in different fields related to your field, possibly genetics or other specialty PhDs. And the course is hands-on, so it's not simply an observational course, and they will be involved in the procedures, the participants. And how long the course you recommend to be? Do you plan for a long-term course or a short course? How is your plan for the course?
Thanks for this question. Our courses, and first I say the time of courses depend on the graduation and degree of the participant, and it's 3 to 9 months, and it depends on the postgraduate or none, and the university they're studying. And about target groups, you asked for me. Target groups is internist and subspecialist of the hemato-oncology, adolescents and pediatrics, and PhD of the genetic biotechnology or other fields that interested for cell manipulation especially, or stem cell transplantation. We can collaborate with them and training together to solve some problems the patient have, or something in the thought of the participant or thought of the me, and this I think helpful for participant and our.
Okay, great. But I think we were able to give a good explanation about the details. If you think there is anything missing and you want to explain anything extra,
I say we have do all types of transplantation in Tabriz University of Medical Sciences in the Imam Reza Hospital. And the patients don't need to go other countries or other provinces for the transplantation. We have many patients from other provinces, even Tehran. We have patients from Tehran, Zanjan, and northwest of Iran. Anywhere we have patients for transplantation. And other countries such as Iraq, Azerbaijan, Syria, and Saudi Arabia, just now we have patients come to transplantation. This is because of our capacity in the doing haploidentical transplantation and cell manipulation with my colleagues. Cell manipulation is the very extensive field and have the multidisciplinary collaboration and talking about the patient. Every patient coming for cell manipulation, we have a meeting and discuss about the number of the stem cell of the patient, T cell of the patient, CD3 positive, and mononuclear cell of the patient, underlying disease of the patient, past medical history, and in overall and the treatment, previous treatment of the patient, or patient overtreated or not. At all in all, we decided to the transplant and cell manipulation. Because of that cell manipulation after transplant, is very important, and we can help and collaborate with many groups, included the genetic biotechnology or other laboratory groups, and I decided to expand this field in the future.
Great, Dr. Babak Nejati, thank you for coming here and being with us today. It was exciting explanations, and I hope that these courses will help many people around the world.
I thanks a lot, and I'm very grateful for this invitation, and this is very great, and welcome to see you.
Thank you.